already prepared some picture. So you can see the pass there. There's actually the France-Italy pass. So very, very, very nice scenery. I recommend anyone to try. So thank you, Edmund, for the very kind introduction. I think you basically have said what is written here. My pet interest is on breast cancer and young women with breast cancer and also pregnancy-associated breast cancer. But of course, I do a variety of general oncology, and my special focus is on women's cancer. So I think for today's talk, I will just pack it neatly into maybe about a 15 minutes talk, and that will comprise like the burden of cancer in Singapore, the things to look out for, and of course, knowing what to look out for, what are the risk factors, what else we can do to help ourselves to prevent cancer. And screening is a very important tool that can help us achieve this goal. So like what I said, cancer is actually the leading cause of mortality in Singapore. It accounts for up to 28-29% of total number of deaths. Pneumonia, stroke, and ischemic heart disease actually come after cancer. So if we look at the burden of cancer in Singapore, we can see 2 columns. We illustrated like the top 10 cancers in men and also the top 10 cancer in women. The top cancer in men is actually colorectal cancer, but this is followed closely by lung cancer and also quite closely with prostate cancer. For women, it's no wonder that breast cancer actually accounts for majority and is the top most cancer in women. It accounts for actually 70%. Then subsequently, the second most common is colorectal cancer and followed by lung, but they trail quite far behind actually. So looking at breast cancer, I just want to touch a little bit on breast cancer being the top cancer in female. If we look at, the graph, I promise there wouldn't be many graphs. So if you look at the graph on the right, you see the pink line, it actually represents the increase in breast cancer incidence over the years. And this timeline I'm looking at is from 2011 to 2015. We see a sharp increase. The number over 5 years that is newly diagnosed is slightly under 10,000. That gives us, about 2,000 new cases per year. But I want to bring your attention to this other graph. If you look at the top graph, it illustrates the incidence rate, that means the total number of new cases per year. But if you look at the corresponding mortality rate of the breast cancer in the same time point, you can see that the mortality rate is actually more or less stable, you see. So that is actually good news. Even though we are diagnosing more and more new cases, the mortality rate is actually fairly stable. There is probably a small increase, and this we can attribute in part due to screening, breast screening, which helps to pick up disease in the early stage where it can be completely cured. So this highlights actually the importance of screening. So what do we want to look out for? We use the word caution, but this is at best a rough guide, you see. So let's go through what it stands for. C actually stands for a change in bowel or bladder habits. A for a sore that doesn't heal. U for unusual bleeding or discharge. T for thickening or lumps in breast or elsewhere. I for indigestion or difficulty swallowing. O for obvious change in a wart or a mole. And N for nagging, cough, or hoarseness. But please just bear in mind, these are just a very rough guide. So if you have any of the above, don't get overly worried. But maybe, if it's persistent and if something that is new, you want to get medical attention so that, any unusual symptoms or signs can be addressed as soon as possible. So I will talk about 3 main cancer in this talk: breast, colorectal cancer, as well as cervical cancer, because we do have a national screening program for these cancers. So the common symptoms of breast cancer usually present as a breast lump. It can be a lump in the armpit, changes in the shape or symmetry of the breast. It can also present as skin changes, like redness, flaky skin that is persistent, or nipple retraction, bleeding, or even frank pain. As I mentioned earlier also, these symptoms may not mean that it is cancer per se. It can be also associated with other benign breast diseases. So when in doubt, and if there's any symptom, still it's best to get medical advice. How about colorectal cancer? Colorectal cancer can present with, frank bleeding. It can be persistent change in bowel habits, including diarrhea, constipation, when otherwise you do not have them, or persistent abdominal discomfort such as cramp, gas, or pain, or a feeling that your bowel does not completely empty. By the time you get fatigue or unexplained weight loss, usually it can be quite advanced. So coming to cervical cancer, actually cervical cancer can present with bleeding following intercourse, in between period, or it can be just bloody vaginal discharge as and when, and also commonly associated with pain, either after or during intercourse. So after we know what are the symptoms to look out for, we also want to be equipped to know what are the risk factors so that we can make appropriate changes. So risk factors can be divided into modifiable, those that we can do something to change, or non-modifiable, those that we really can't change. So these are some of the risk factors catered for breast cancer, but it's also very general and it caters for other cancer as well. So some of the modifiable risk factors include sedentary lifestyle, obesity, alcohol consumption, smoking. All this predispose to cancer formation actually. And for breast cancer per se, taking hormones in the form of hormone replacement therapy or certain types of oral contraceptive pills can actually increase your breast cancer risk. So diet is also very important. I will go into this later on. Some of the non-modifiable risk factors includes age. So aging is something we can't control, and as we age, the cells replicate and can make mistakes. So this is something that we can't control, just like our family history. So family history of maybe hereditary gene responsible for cancer formation, and for breast and ovarian cancer, that is our BRCA genes. Early menarche and late menopause, actually, they increase the overall duration of time that the female body is exposed to female hormones, as well as delayed or no childbearing, and also exposure to radiation. So what can we really do? So this is for general, it helps to prevent cancer in general. Exercise is, of course, very important. I strongly advocate exercise. Do not drink, or at least drink in moderation. Quit smoking, keeping a healthy weight. And if you're menopause or undergoing menopause, you may want to discuss hormone replacement therapy with your doctor. So how much exercise is needed? WHO actually recommends 150 minutes a week of moderate intensity exercise. And we are not talking about shopping. So like real exercise that gets your heart beating. 150 minutes a week is not easy, because if you divide by 5, you need to exercise like 30 minutes for 5 days out of a week. For me, it's also fairly challenging, but I try my best to hit this target. So so these are more pictures, very beautiful scenery. So I think the best way to do something consistently is to do something you like, right? So I think if you don't like exercise or don't have the habit, maybe just start with going back to nature, going for a walk, and then develop a hobby around it. So that's my recommendation. So the American Institute of Cancer Research has a more detailed, changes to lifestyle recommendation, and we can go through them. They are more or less similar to what we have outlined, just in more detail. For instance, for diet, try to eat a diet rich in whole grain, vegetable, fruits, and beans. Limit consumption of fast food and other processed food high in fat, starch, or sugar. And also red meat or processed meat, things like some certain like sausages, luncheon meat. These are all processed meat. And also limit consumption of sugar or sweetened drinks. And the rest, I think we have already mentioned. So next, I would like to talk about screening. I think screening is a very important tool that can help us to detect cancer in the early phase. So we will talk about the 3 national screening programs that Singapore has. For breast cancer screening is recommended for women above 50 years of age, and they are advised to do mammogram once every 2 years. For women who are between 40 to 49, it's advisable for them to discuss breast cancer screening with their doctor. And if they need to go for breast cancer screening, it's usually advised to do it yearly instead of 2 yearly. So what does it involve? It involves mammography, and you may ask, what is it? It's basically an X-ray picture of the breast where the breast will be sandwiched between 2 plates for the X-ray to be taken. Some people may feel that, if their breasts are maybe a bit more sensitive, they may feel that it's quite painful. But there are some tips to go about doing it. Try not to do the mammogram like just before your period or during your period, because your breast can be more painful. And do not wear perfume or deodorant when you're getting a mammogram done. How about colorectal screening? It's recommended for colorectal screening when you're past 50 years of age. The screening tools usually use fecal cord blood, and it's done by either the FOBT test or the fecal immunochemical test. So if you look at this specimen collection bottle, a lot of people may not want to do it because they think that is a lot of hassle, but what you need is to just collect 2 specimen bottles. They are very small. Bring it home. You can do your own sampling over 2 days, 2 consecutive days or 2 different days, and just bring it back for testing. I think what people worry most is, what if it's a positive result? Following a positive test result, then you may need to undergo further testing and evaluation with a colonoscope. So for cervical cancer screening is advisable for women or girls or women who are sexually active. So usually they are recommended to get a pap smear every 3 years. And if they are more than 30 years old, it's advisable for them to do a human papilloma virus test together every 5 years. So how is it done? Usually it's done by inserting a speculum into the vagina to open it up slightly. If done properly, it's actually a little bit uncomfortable but not painful. So then we can insert a brush in to get some of the cells for testing. And this allows us to analyze for precancerous cells. So what exactly is human papilloma virus? So human papilloma virus is a common virus. Actually, there are more than 100 different strains, but there are only 2 main types that cause cancer. So what we are doing in the vaccination program is to help protect against the specific type of HPV infection that can lead to cervical cancer. And in Singapore, we have 3 types of vaccine, and they are available for young girls from 9 years onwards to 26 years old. So if you have young children, young girls, it's best to talk to your doctor about vaccination for them. And it's best to give as early as possible because the immunity is better and maximized when given before the start of sexual activity. So we talk a lot about flattening the curve, for the COVID. In cancer as well, we also want to flatten the curve. I think if we look at the cervical cancer graph, we can see that over the years from 1976 to, more recently, like 2015, the curve has, gone down a lot. And this is all really thanks to, pap smear testing, screening, and also the HPV vaccination. Even for breast cancer screening, it has helped us to keep the mortality almost flat while the incidence rate actually increased. So I think if we need 3 take-home points, it will be to eat healthy, to do your screening, and to exercise. So I hope these take-home points will stay with you. So I conclude my talk, and I've provided my email also. Okay, so back to you, Edmund.
Yep, thank you, Dr. Lee. Thank you for the information. Okay, we do have some questions coming from the floor. Right, so I know you did mention something on the early symptom of cancer for breast and colorectal, but unless I missed it, what about lungs? Are there any early symptoms for lungs?
Okay,
lung cancer.
So for lung cancer can present with, persistent cough, and if the cough comes with like blood-stained sputum, usually it's persistent cough, hoarseness of voice. By the time there's weight loss or difficulty breathing, usually it's a very late stage. Lung cancer screening is not in the national screening program because there are evidence for and against lung cancer screening. However, it should be catered to individuals. So for individual with high risk, for instance, more than 30 pack years, if they're heavy smoker or still smoking, and if they're more than 55 years old, then it's also best for them to consult a doctor to discuss lung cancer screening.
Okay. We have a question from one of our participants with regards to is cancer a hereditary illness? And I remember you did mention it was. But are there some statistics probably that we should take note of? Because what I did learn was, at least for heart, based on our last week webinar, if your paternal side father has heart disease before 55, then you run a higher risk. And if your maternal side before 65, you also would run a higher risk. So it depends. So cancer, are there any of these statistics that we should probably be aware of?
So is cancer a hereditary disease? Not all cancers are hereditary. Cancers can be sporadic or hereditary. Sporadic means, right, the mutation just arises because as we age, our cells needs to replicate, turn over. Our cells are growing every day, like turning over every day. So in the process of aging, like, if a machinery does work non-stop, it will become faulty and break down. The same with human body. So sporadic cancers are cancers that arise not due to inherited disease, you see. So 95% sporadic, maybe about 5% hereditary, 5 to 10% generally. So for hereditary disease, it's very important for us to be aware of it, at least know our family history. If we have a strong family history like multiple relative, first degree relative or second degree relative with cancers, or cancers at a young age, usually less than 50 years of age, then we probably should get a genetic counseling involved so that we can further analyze our risk.
Okay. We have another question from Mr. Lee. Mr. Lee is curious, how effective is the vaccine for cervical cancer?
Well, you can see from the graph, actually, the vaccination is fairly successful in bringing down, actually, the incidence rate of cervical cancer. The catch will then be, like awareness. How much are people, how much people know about the vaccination? I think in Singapore per se, I would say the picked up rate of the vaccination is not that high yet. It requires a lot of health promotion, a lot of promotion to create awareness so that the pickup rate is higher. But we see that the cervical cancer incidence has come down. In fact, in US, they are actually trying to push up the vaccination program even to cover boys. In Singapore, it's currently available for young girls, but we have not extended to boys. So for boys, it's recommended for them to, if the parents are interested, keen to know more, it's recommended for them to talk to the doctor to discuss vaccination.
Okay, and what age should the lady start the vaccination?
9 years old. So it's advisable for them to start as young as possible for the vaccination to be effective, because the immunity boost at a young age is better at getting an effective vaccination. So in fact, if you are between 9 to 14, the number of doses that you need is 2 doses for the vaccination. Beyond that, then you need 3 doses at least.
Okay, okay. All right. We have another question, and from, I cannot mention his name. If there are swollen lymph nodes that haven't gone away after a month, what are the chances that it's cancer? It has become smaller but haven't gone away.
Okay. For any persistent lymph node, I think it's advisable for you to get a check. Hard to say the percentage, because lymph node can be reactive and it depends on where. But if you can notice it, it must be somewhere quite obvious, like neck or somewhere obvious. Usually lymph node can be reactive to infection, but generally for infection, it goes away after 7 to 10 days, or even like for viral infection, it can go away after 14 days. So generally for reactive lymph node to infection, it does go away, unless you are talking about a prolonged illness, prolonged viral illness or prolonged bacterial illness, then there is a chance that the lymph node can linger on. Or any chronic inflammatory disease or skin disease or chronic diseases can predispose to lymph node being there longer than it usually is. But any persistent lymph node more than close to a month, you should get it checked.
Okay, thank you, Dr. Lee. The next question, perhaps I ask to our panelists. Maybe to Esther. Esther, for this question, typically we feel that the Shield plan itself would be more than sufficient to cover for any of the cancer treatment that one may have, right? So could you care to comment on that, Esther? Is Shield plan really alone really enough?
Okay, I think Shield plan is important to cover the medical expenses. However, the critical illness coverage is where it can replace our income to take care of things like our expenses, our commitment, and it's very importantly, it helps us to maintain our lifestyle. So what's important to do is to look at a complete coverage, having both in hand rather than only focusing on one. Yeah.
Okay. Do you have any situation in the past dealing with your clients that unfortunately they found out that the Shield plan was not sufficient? Could you perhaps share one or two of these experiences, please?
Okay, I have a client who was diagnosed with kidney failure. So sadly, she's only covered with a Shield plan. So good thing is the dialysis coverage is taken care of. However, for the transplant portion, the family members would have to fork out the coverage, the cost for the donor. Yeah. So there are expenses that might not be covered under the Shield plan as well.
I see. Okay. Thank you, Esther. Maybe the next question I can pose to our next panelist. There's always a saying that insurance always are very difficult to claim. Lee Hong, could you share some your views on this? Insurance is very hard to claim.
Okay. Personally, I've done quite a fair bit of hospitalization claims, and also sadly some death claims as well as critical illness claims. So I think when clients experience difficulty in claiming, a lot of times it's actually the administrative aspect of it, because when it comes to a hospital claim, some insurance company may ask for certain reports from the doctor, and especially for this critical illness claim, the insurance company will require certain maybe lab results, and for the claim forms to be duly filled in by the doctor as well. So all these can actually delay the claim, and if the client is actually not familiar with it, it can be quite taxing, or they find it difficult. Yeah. And maybe the other point of view is that they find that, you know, how come like always certain things cannot claim, and then insurance company will come back to say, oh, this is not claimable because of certain reasons. What I want to emphasize is that when it comes to buying any of these health policies, always declare your health conditions properly, because you do not want the insurance company at the point of a claim, they will usually do some checks and they uncover certain things that, you know, should have been declared in the application form. So all this would help in claims, and having, of course, an agent to follow up and assist in all this process will really help a lot. Yeah.
Lee Hong, in your past, have you met any prospects or probably friends, probably not your client, because I know you would probably be very overemphasized that they would have to declare every small symptom. But have you met anybody outside in your course of work over these past 20 over years where you've seen such case happening, and could you perhaps share a little about the difficulty or the feelings or emotions that they have to go through?
I'll talk about the difficulty of the claiming part first. This is actually one of my clients. The insurance company actually requested certain information from the hospital. However, the medical records office work in such a way that when the person is admitted, the whole file goes back to the ward. So there was quite a lot of ding dong, and then the client kept thinking that, you know, the insurance side is delaying, and the insurance side said, no, we're still waiting for the report. So this requires somebody to step in, you know, to find out what is actually holding up the whole process. So I guess, you know, yeah, I was the one to step in and find out what was actually going on. So all this can actually pose, you know, emotional stress to the clients during a difficult period. So it'll be good for the agent to actually assist a lot during this time. So that is like so-called one difficult claim because of administration process. The other part where I say, you know, where you have to declare in the application properly, if anyone has applied for health insurance or critical insurance, you will know the, you know, number of questions that is in the application form. It's very detailed. It is a lot of trouble to go through them. Yeah, and sometimes for the clients, it is also a lot of trouble for them to try to think back and say, oh, okay, let me think. So a good record keeping for yourself in all these areas would help. And once you have started with an agent, he or she has your, you know, so-called record history, that would help a lot also to keep a good record and just declare everything properly, because you don't want to have the insurance company thinking that, hey, you know, are you trying to hide something, you know? And in the time during a claim, you know, they may look back and say, hey, how come this wasn't declared? And that condition could have been something that led to, you know, the claims. So yeah, always declare properly and have an agent to assist you in all this area. It really helps a lot. Yeah.
Yeah. Just a question. Very frequent, we meet people who used to smoke, and I mean kudos to them. They stopped smoking for 3 months, 6 months, and we all know that the smoking rate for critical illness insurance versus non-smoking rate is a stark of difference, right? What's your advice for somebody who has just quitted for 6 months and then subsequently would like to apply for critical illness? Should they declare or not declare?
Okay, I think for most insurance companies, smoker is defined as someone who has smoked a stick in the past 12 months. So if the person has actually so-called smoked, you know, any stick in the past 12 months, like your example, you say quit, you know, 6 months ago, my advice is still to apply for the insurance as a smoker. Okay. However, another 6 months later, what a person could do, or what the client could do, is actually to go for a particular test. If I'm not wrong, it's some nicotine test, and then that will detect any traces of nicotine in the so-called blood or urine. And with that, you can actually write into the insurance company to say that you have quit smoking. These are my lab results, and the insurance company could consider him as a non-smoker rate.
Okay, thank you, Lee Hong. The next question is for Dr. Lee. Dr. Lee, if an ultrasound breast result shows sub-centimeter cyst, how likely would it develop into a cancer?
Okay, so usually for cysts, and especially if they are sub-centimeter, the risk is not high. But I think versus like, how likely they are to develop into cancer, maybe I can share, what are the specific features to look out for cysts. So for ultrasound, if you see complex cysts, like semi-liquid, semi-solid, and they are complicated cysts, then they ought to be addressed more in detail. Sometimes we may even need to draw out fluid from the cyst for testing and to see whether the cyst collapse completely. If it doesn't collapse completely, then there's a solid component, then you need further examination and even potentially a biopsy. But these are usually more than 1 centimeter, whereby, they can even be accessed, via needle or core biopsy and things, other investigation. So for sub-centimeter cysts, we usually leave it alone and we monitor serially with serial ultrasound.
Okay, thank you, Dr. Lee. And then next question also for you, and it's a very interesting question. Are there any vaccinations specifically for men?
Exercise. Okay, jokes aside. For men, I think the most important vaccination is hepatitis B vaccination. Hepatitis B vaccination, protects against hepatitis B, and we know that chronic hepatitis B infection can actually lead to liver cancer. So hepatitis B vaccination is very important for men. You may consider, at a young age for boys, you may consider HPV vaccination. That is some of the more important vaccination for men.
Okay, thank you. Next question also for you, Dr. Lee.
Right.
Can irregular menses after the age of 25 be one of the indicators for cervical cancer or ovarian cancer?
So I think so to put it simply, I think when you have irregular menses, it affects the diagnosis of the cancer and it may predispose diagnosis at a later stage. Why do I say that? Because when you have irregular menses, it's very difficult for you to, differentiate between abnormal bleeding with your regular menses. Because if you have regular menses, then if you get intermenstrual bleed, then this is not normal, and then you immediately go and see a doctor. But for someone with irregular menses, sometimes you get confused and then you may delay your symptoms and then get medical attention later on. I think this is probably the confounder that I can see that can affect diagnosis and delay the diagnosis. But otherwise, irregular menses is usually due to hormonal changes, and it should not it should not increase the risk factors to you getting both.
Okay. All right. There's one question on the chat, and Mr. I shall mention his name, asking for a friend, male, 31, non-smoker, no family history. What are some of the things to take note and be cautious of?
That's like most of us, right? We are maybe probably around that kind of age, and family history is good. Yeah, that sounds like a healthy individual. So what are the things to take note of? So the few things that I've been trying to put across, like exercise, eat well, not dieting, but try not to smoke, try to cut down on alcohol, and yeah, go for screening.
Okay. Thank you. We do have one more question, and maybe I shall ask this question to Lee Hong. Typically for critical illness coverage available out there, we do have to wait to very late age before we can claim. So Lee Hong, could you perhaps share your insights on this? Thank you.
I think that was what's available in the market previously for a long time. But I think we have this new group of policies that came into the market, maybe probably 7-8 years ago, I can't remember the dates, where we call it early stage critical illness coverage. In the beginning, it was quite costly, but in the past few years, due to competition, the rates are actually very attractive now. So this is a policy contract that basically covers the critical illnesses at a much earlier stage. Meaning that the payment, the claims will be paid out when the illness is at a much earlier stage. So yeah.
Yeah, I do understand that actually we have prepared, and Esther has specifically prepared for some of this definition, and I think it'll be good since we do have a doctor. She will be able to shed some light on what this definition means and how early is early, how major is major, how intermediate is how intermediate. But before that, maybe Esther, would you like to help us run through the definition of these major cancers, please?
Hi, okay. So I think the definition for critical illness have come a long way. So this is the current definition of critical illness. As you can see, in order to claim, cancer needs to be uncontrolled growth, malignant, and invasive in nature. This is the current cancer definition. So let's look at what's going to happen in August. So come August, this highlighted, the words highlighted in red would be added into the definition. So if I were to summarize this, what it means is that liquid biopsy would not be able to be claimed under cancer in the future if you bought the policies after August. So can we have the next slide to see the comparison? So if you were to put the definition side by side, besides having liquid biopsy not being claimable, there are many other exclusions that would be added into cancer as well. So, Dr. Lee, is it possible to check with you for liquid biopsy? Is it common in your professional experience?
Okay.
That, how often have you come across people being diagnosed this way?
Okay, so liquid biopsy is actually up and coming field, you see. However, I must say that, for liquid biopsy is used actually in various stages. Like it can be used in diagnosis, it can be used in surveillance, it can be used for monitoring for cancer recurrence and all that. However, to establish a totally new diagnosis of cancer based on liquid diagnosis alone, liquid biopsy alone, is actually not common in our current setting. We use it more for surveillance and monitoring of cancer recurrence rather than for a brand new diagnosis. For a new diagnosis, we still rely very heavily on the traditional biopsy where we need to take sample from a solid tumor.
Okay. So now let me just cover the definition on early critical illness. So under early stage, as early as carcinoma in situ, we would be able to claim, and you would not require it to be invasive. As for intermediate, you would need to minimally have gone through a radical surgery. For advanced, the cancer need to be malignant. So Dr. Lee, can I just understand from you, from your experience so far, usually how long does it take for carcinoma in situ case to progress to the next stage? Does it mean that carcinoma in situ, if we are able to find out, at such an early stage, there's a very high chance of recovery?
So carcinoma in situ is actually a very technical definition because it means that the abnormal cells has not breached the basement membrane. Usually it just means that has not resulted in invasion. So it doesn't invade the surrounding tissue, and it can be completely cured if it is diagnosed early and discovered early.
Okay, that's good news. So I think I would just like to highlight to attendees today, if you are able to get yourself covered, even all the way up to the early stage, like what Dr. Lee has mentioned, there is a high chance of being completely cured.
Dr. Lee, I do have a question for you as well. Could you share from your experiences? You have many decades in this medical field. The treatment cost, does it increase year on year, and typically at what rate have you seen it increase?
So I would say for cancer expenses, right, it has increased quite a bit in the recent years. And the reason why I say this is because, there is an expansion in the field of targeted treatment. And because of all this newer medicine and all these are generally targeted medicine, and even, with the advent of like immunotherapy, all this new developments, which are actually very good for the patient because, they are getting like better treatment and they can live longer. But it also means that, the cost of the treatment, they have been escalating. So year on year, definitely escalating. The proportion, the percentage, it really depends on the specific type of treatment we're talking about. Because if you are talking about just chemotherapy, the increase is actually not as much. But if you are talking about immunotherapy, the increase in the price is actually quite a lot.
I see. And so with regards to early cancer versus an advanced cancer, is it safe to say that it's cheaper for treatment during carcinoma in situ stage versus an advanced stage?
So for carcinoma in situ, sometimes we say that it's stage 0. Usually for this type of cancer or this type of disease, we don't even term it cancer, you see. We say early stage 0. And usually the treatment is surgery. Let's say for ductal carcinoma in situ, for the breast, usually it's just surgery to remove it. And after that, the patient is considered cured and the patient probably needs surveillance following that. For early stage or advanced stage, for like stage 1 or stage 2, generally the principle is that for early stage cancer, it can still be cured, and usually it involves removal of the tumor. For advanced stage, if it's stage 4, generally we are talking about not curable, but the cancer can still be very treatable.
Okay. Thank you very much. Yes. Li Hong, yes, Li Hong.
Yeah, just one last question. Dr. Lee, this carcinoma in situ thing, is it like a more common occurrence for certain type of cancer that it can be discovered at carcinoma in situ stage, or is it like across for all types of cancer?
That's a very good question, actually. So it's basically more common for things like, breast cancer, where you get ductal carcinoma in situ, and also cervical cancer. You can get CIN, which is really pre-malignant, and that can be easily treated and cured. So there are some cancers which are, more common to get the stage 0. Rather, if you talk about ovarian cancer, liver cancer, those are like, internal organs. By the time it's diagnosed, usually, it's at a very advanced stage.
Okay. All right. Thank you.
Okay.
Thank you, Dr. Lee.
Okay. Thank you, Dr. Lee. Okay. We are coming to an end towards our webinar already, and today the webinar is brought to us by Icon Healthcare Group. So what they have also extended to us is this Icon Women's Essential Screen. Okay, there are 2 versions, which is one is below the age of 40 and one is above the age of 40. I used to think that essential screening like this will probably cost nearer towards the 500 range. But I think the 189 and 269 is really very, very affordable for us just to be safe and to do our regular health checkup. All right, and we do know there are some concerned men over here, so don't worry. We do have, Icons also have the many essential screening. All right, so consultation, full, and we have an ultrasound prostate investigation. All right, so it's definitely an essential that we would have to go through. Yeah, and then last but not least, okay, Icon health screening, what they also do is they have a personal plan supplement customized for your individual health needs. So basically, they will understand what your body needs. You don't have to over supplement yourself, right? And then ensure you get the right dosage. So if you're interested to find out more for the women package, the male package, or personal plan of supplement, find out through the person who has invited you. All right, okay. Now, thank you very much for joining us. We are approaching 4 o'clock. In fact, we have passed 2 minutes past 4 o'clock already. We really appreciate you joining us on this Saturday. And if you have not followed us on Facebook, please remember after this to please just follow us on Facebook. The reason why we're not going to bombard you with anything that you don't need, but we want to bring value to all our friends on Invictus, because at Invictus, we believe in building relationships for life, right? Okay, so that's the end. We're gonna flash the video so you could like help us to understand. Thank you. Okay, bye-bye. Thank you very much for joining us.
全部自己人了。等一下
OK，你可以
我打给你
pause。invite Nick 跟 Dr. Lee 回来，谢谢。不用，我自己打，我自己打。
OK，
呀。
我先 stop recording 先。